As we grow older, there's a quiet change happening inside our bodies that many of us don't think about. Our immune system, once quick and strong, begins to slow down. That change makes it harder to fight off infections. It also means that illnesses we might have easily recovered from in our younger years can now lead to serious complications. The good news is that vaccines are one of the most effective tools we have to stay ahead of those risks. They help boost our defenses and keep us healthier longer. Still, the world of vaccines can feel confusing. You might hear about new recommendations every year, updates about booster shots, and unfamiliar names for vaccines you didn't even know existed. That confusion can lead to inaction, and inaction can lead to preventable illness. So let's break it down clearly and calmly so you understand which vaccines matter most after age 60 and why they're worth your attention. Each year, the flu returns in slightly different forms. For many people, it's nothing more than a few days in bed. But for older adults, it can quickly spiral into pneumonia or require a hospital stay. It can even turn deadly. That's why getting a flu shot every year is so important. The vaccine changes to match the latest version of the virus. And for seniors, there's a specially formulated version that offers stronger protection. It's called a high-dose flu vaccine, and it helps trigger a better immune response in older bodies. Another vital vaccine protects against pneumococcal disease, which includes a range of serious infections like pneumonia, meningitis, and bloodstream infections. These are not rare in older adults, and they can be devastating. Fortunately, the vaccines available today can prevent many of these outcomes. There are different types of pneumococcal vaccines, and depending on your medical history, your doctor might recommend one or both. These shots protect against a variety of bacterial strains, helping your body stay one step ahead. Now consider shingles. This painful condition comes from the same virus that causes chickenpox. After you recover from chickenpox, the virus doesn't leave your body. Instead, it hides in your nervous system, sometimes for decades. When your immune system weakens with age, that virus can reactivate and cause shingles. It usually appears as a painful rash on one side of the body, but the pain can last for months or even years. Some people are left with nerve damage that never fully heals. That's why the shingles vaccine is such a game changer. Called Shingrix, it's a 2-dose vaccine that is more than 90% effective at preventing shingles and its long-term complications. If you're over 50, it's one of the best decisions you can make for your health. There's also the matter of tetanus, diphtheria, and pertussis. These might sound like diseases of the past, but they're still out there. Tetanus can enter the body through something as simple as a cut from a rusty nail. It causes painful muscle stiffness and can become life-threatening. Diphtheria is a serious throat infection that can block airways. Pertussis, better known as whooping cough, causes severe coughing fits and can linger for weeks. If you haven't had a vaccine for these three in the last 10 years, it's time to get one. The combination vaccine is called Tdap, and if you've never had it, you should get it now. After that, you'll just need a booster every decade. COVID-19 reshaped the way many of us think about illness and prevention. Older adults are among the most vulnerable when it comes to severe outcomes from this virus. That includes hospitalization, long-term complications, and even death. Vaccines and booster shots have dramatically lowered those risks. Staying up to date with COVID vaccines is essential. These aren't one-and-done shots. As the virus evolves, so do the vaccines. Boosters are created to match the most common variants circulating at the time. If it's been a while since your last shot, talk to your doctor or pharmacist about whether you're due for a new one. Some adults over 60 may also need protection from hepatitis B. This virus affects the liver and is spread through blood and bodily fluids. You may be at risk if you have diabetes, kidney disease, or live in a group setting like a nursing home. For those with risk factors, the hepatitis B vaccine is strongly recommended. It's given in a series of shots and offers long-term protection against a very serious disease. There's another vaccine that may apply in specific situations. That's the meningococcal vaccine. Meningococcal disease is rare but extremely serious. It can cause inflammation in the brain and spinal cord or lead to deadly bloodstream infections. It spreads easily in communal living situations and can progress rapidly. If you have certain health conditions or live in long-term care, this vaccine might be right for you. It's not for everyone, but it's worth asking your doctor if it makes sense in your case. Now, with all of these vaccines to think about, keeping track of what you've had and what you need can be tricky. The best place to start is by keeping a personal vaccination record. Bring it with you to each doctor's appointment. That way, your provider knows your history and can help fill in any gaps. Don't wait for them to bring it up. You can ask. It's your health. You have the right to be proactive about it. Many vaccines for seniors are covered by Medicare. That means there's usually little or no cost to you. Pharmacies are also making things easier by offering vaccinations on a walk-in basis. You don't always need a full doctor's visit just to get a shot. This kind of access makes it much easier to stay on schedule, even if your routine is busy. You might be wondering about side effects. Most vaccine side effects are mild and short-lived. Some people experience a sore arm, a bit of fatigue, or a low-grade fever. These symptoms usually pass within a day or two. What they leave behind is much more valuable. They leave behind protection. They reduce your risk of serious illness and help your immune system respond more quickly if you ever do come into contact with a harmful virus or bacteria. Vaccines are not just about avoiding disease. They are about maintaining your lifestyle. They protect your independence, your ability to travel, to socialize, to spend time with grandchildren, and to do the things you enjoy. They reduce your chance of ending up in a hospital bed. They lower the odds of being sidelined by long recoveries or complicated treatments. When you invest in vaccination, you're investing in more good days ahead. It's easy to overlook things that don't feel urgent, but prevention is always more powerful than treatment. Taking control of your vaccine schedule is one of the most straightforward, effective things you can do to protect your health. It's a simple conversation, a quick appointment, a decision you won't regret. So if it's been a while since you reviewed your vaccinations, do it now. Talk to your doctor or your pharmacist. Ask questions. Take notes. You don't have to remember it all on your own. You just have to take the first step. This is about more than staying healthy. It's about living fully, and every vaccine you get is a step toward that life. One where you feel stronger, safer, and more prepared for whatever comes next.